Once somebody has a diagnosis of cancer, what do they do next? I think the first thing to decide, and I think it's probably the most important thing to decide, is where do I get treated? A diagnosis of cancer is overwhelming. But if you can make a good decision as to where you choose to get treated, life gets a lot simpler. There are lots of options to be treated for cancer in the United States. The pinnacle of the care is considered what we call NCI-designated cancer centers. These are top-notch cancer centers spread out throughout the United States, and they usually have doctors who subspecialize in every field of cancer. Now, the other end of the spectrum is a community oncologist who takes care of patients right in their neighborhood. Now, there are things in between as well. Academic cancer centers that are not NCI designated, and a whole host of other accreditations for cancer centers like community comprehensive cancer centers. This decision becomes very important, but it's not cut and dry. The reason for that is where you live becomes very important. How much do you have to transport becomes very important. How much family support do you have? That's very important. But also then, is your cancer something that treatment is fairly standard for? Or is it something that requires a lot of subspecialization? One size does not fit all. So it is very important when you're making these decisions to talk to your family doctor. Talk to people who've already seen local oncologists or have gone to major cancer centers, and then help make your decision. One is not necessarily better than the other, but your situation should match where you go. The reason this becomes so important is if you have what is considered fairly standard therapy, it is probably best to get it close to home. If you have a disease process that's relatively rare, it is probably the best thing you can do is go to the best place you can go. Now, how do you decide this? Your decision does not have to be irrevocable. Go and see your family doctor and see where can he get you in quickly. Also, ask him the same questions I just asked you. What would suit the situation? Once that decision is made, you can then go see either the local oncologist or go on to an NCI-designated cancer center. The reality of it is both work. If you do have a complicated situation but cannot get to a major center to get all your care, you can always go to them for a second opinion and coordinate care. But do not take this decision very lightly. We at Cancer GPS have put down an algorithm and also a listing of the different cancer centers you can go to. Pay close attention to that, and if you have any questions, please reach out either to Cancer GPS, the American Cancer Society, or there's a whole host of other cancer centers that can help you. But stay local as much as possible, and then go from there.